chronic UTI severely impacts people's quality of life. This isn't a trivial condition. That people's lives, their relationships, their ability to work has in many cases been completely derailed.
Speaking with Deirdre Pinto, who has been involved with Chronic UTI Australia since its incorporation in 2018. Chronic UTI Australia is the nation's first and only organisation devoted to urinary tract infection. Now retired, Deirdre has a 32-year career as a policy analyst and program manager in the Health and Community Services area of the Victorian State Government. In addition to her voluntary work with Chronic UTI Australia, Deirdre has been involved in advocacy for a rare neurological disease, has served as secretary to the board of a support and advocacy group for women living with HIV/AIDS, and is actively involved with an animal rescue group and an association for families of children impacted by hemispherectomy brain surgery. Thank you so much for joining me to answer our community's questions.
Thanks very much, Melissa. It's nice to be here.
I'm glad that we could organise this, given the differences in our time zones.
Yes, and I know it's very early for you.
Yeah.
So thank you for getting up.
It's okay, because I'm a morning person, so I'm looking forward to this conversation. We've had a few people reach out to us over the last couple of years asking for advice about starting their own organisation in UTI in their country, which I think is amazing, but it's also really difficult to start an organisation. So I thought it would be great to get some insights from you about that journey in Australia. And the first question is, when did you launch Chronic UTI, and why did you decide to start an organisation centred on UTI?
Well, look, we launched officially in 2018 when we incorporated the organisation, but for about 5 years before that, Chronic UTI Australia existed just as an information website, which was established by one of our other co-founders based on her experiences. But, increasingly, there was a small group of us, 4 women. We met online as a result of that website. And it became really clear to us that we needed some advocacy. We needed a formal structure if we were going to affect the kind of change. Increasingly, it was clear it wasn't enough to just provide information about how bad the testing was, the problems with treatment. We needed to do something about it, and that required a proper organisational structure.
And what were you hoping to achieve by organising this organisation?
Yeah. Well, our goals, were to, put UTI, and particularly chronic UTI, on the map. We wanted recognition and awareness of chronic UTI. But really, most importantly, we want better testing and treatment for all forms of UTI.
And how did you go about formalising the structure of Chronic UTI Australia? And did you have government support, or did you have other external support?
No, we didn't have any. We still have no government or industry support of any kind. So I guess the first steps were a bit of, internet-based research. We wanted to look at what else was out there. We didn't want to reinvent the wheel, but we were quite surprised to find there wasn't really any big national organisation that was looking at UTI and the problems. So we could see a clear need for a national patient-centred organisation. And in terms of how we went about setting up the organisation, that was very much it was quite painstaking. We didn't find any place we could go within government to teach us what to do. We just had to work that out for ourselves. In Australia, there's a process by which you apply to state governments to be incorporated as an organisation, and there are benefits to being incorporated, legal benefits. I won't get into the technicalities. So that was the first thing we did. We're incorporated in South Australia, but then beyond that, if you want to raise funds, attract donations, that kind of thing. There are real benefits to being a registered charity. And we have a body in Australia called the Australian Charities and Not-for-Profit Commission. So that's we got ourselves registered as well. And probably the last bit of the process is probably the most difficult, but it's very beneficial when you're trying to get donations from the community if you have tax deductibility status. Then that means that if people give you money, they can claim a deduction on their tax return. So we did that as well, and then that's the final step. But I mean, as I can talk about in more detail, there are a lot of different things that go into forming an organisation and meeting the requirements of being an incorporated.
It's a complicated process.
It is complicated.
Did your professional background help with any of this?
I'd like to say yes, but probably not so much.
Okay.
My background is as a government policy and program manager. So the world of not-for-profit organisations was all new to me. I'd been experienced working with a US-based organisation that was our equivalent of a not-for-profit charity, but because being Australian, I didn't do that legwork, and things were quite different in our country. So we really had to find out what the rules and processes were in Australia.
I can imagine.
Yeah.
So who else is behind the organisation and was helping with this process?
Well, as I said, we started off with a group of 4 women, and that's waxed and waned over the last 6 or 7 years, depending on what's going on in people's lives. But there's been two people that have really been consistent all the way through, and I think that's been quite important. A, to have that consistency, and B, this is something, we're all volunteers. We don't get any, we don't get any government funding. So to try to do this as one person, unless you're willing to to do this for 10 hours a day, and everyone's got other lives, you really need at least one other person sharing the workload. So we've been fortunate to have myself and Andrea Sherwan as the core of that organisation, and fortunate that we work very well together and have a similar vision for the organisation.
Yeah, it's really great. I remember talking to Andrea probably in 2017 when we were starting to launch Live UTI Free, and being Australian myself, I wanted to reach out to see what was going on there. I think Chronic UTI Australia was one of the earliest chronic UTI organisations in the informal stages when the website launched. Yeah,
I think there were a number of websites launched around the same time, around 2017, 2018, or even a bit earlier. And that was good because, as you know, it's led to a bit of a collaboration worldwide of similar organisations.
Yeah, I wanted to mention that too. Just about a year ago, I think we formed the Alliance for Patient-Centered UTI Research with Live UTI Free, Chronic UTI Australia, QTIC in the UK, and Let's Talk UTI in the US, which has been really nice so that we can talk to each other about what's going on in our regions and possible collaborations for research.
Yes, and we all have very similar aims and goals and visions. Obviously, the challenges are different, and different, as Laura said in your previous interview, everyone has a slightly different slant, but I think it's really important that the patient community has advocates in their own country that they can look to.
Yeah, definitely.
And get involved in.
Yeah, there's a lot of work to be done, obviously. We've been doing this for 8 years, and Chronic UTI Australia's been around for a bit longer than that, and it feels like there's a lot to be done. But I wanted to ask first about some of the challenges that you face as an organisation in Australia.
Oh, look, organisational challenges, and this is something that I looked at in my master's thesis that you mentioned in the introduction. I did a Master of Philosophy research project on looking at how rare disease organisations influence research and the development of cures for their conditions. So I had a good theoretical understanding of the challenges facing these kind of small organisations, but I guess I've lived that in practice through our experiences with Chronic UTI Australia. Obviously, funding is a challenge. We're reliant on donations from the patient community, and we have some very generous support, but getting broader funding, and we do have a strong policy against taking industry funding. We want to be seen as completely a complete patient voice that's not influenced by outside. So we haven't been able to attract government funding. We find it quite difficult to get grants. It's very competitive. So those are the challenges. But beyond that, I think managing volunteers, all our work is volunteer based, but it is actually a process to manage volunteers. That's been a challenge. Just the sheer workload, I think, is quite challenging. As you said yourself, we've been going at this and we've been working very hard, very consistently for 6 or 7 years, and it feels like we've made progress, but we're only just beginning. So, and it's a lot of work.
Yes, I agree. Do you feel like the conversation has changed a little bit? We've noticed that when we tried to apply for grants throughout the last 8 years, and we would just get nowhere. But in the last couple of years, I feel like there's more money coming to UTI, partly because of the AMR conversation. But it means that researchers are coming to us with grant opportunities, and we have been successful in getting some grants more recently. Have you seen the same?
Not really, no. We're not in terms of, we've certainly noticed a change in the conversation. At this stage, I can't say with any honesty that it's translated into success in grant applications, but we certainly have researchers coming to us and we support their applications for research, but what our feeling is that at this stage, for whatever reason, UTI research isn't the highest priority in Australia. So that's something that we're hoping to change. But in terms of the conversation around chronic UTI more generally, yes, I think we've seen a big shift. And if I can just mention some personal experience.
Of course.
My interest and commitment to this area is based on my experience as a mother of a young adult who has a chronic UTI, and she first developed symptoms of a chronic UTI in 2017, and she was very young then, so I accompanied her to all her medical appointments. And the conversation around chronic UTI was basically, if I may summarise, and we're talking lots of different GPs, emergency departments, a couple of urologists, was there is no such thing as chronic UTI. We had a GP who literally laughed at us when we raised that spectre. Now, as a result of media that we've helped orchestrate, as a result of connections that we've made with professional organisations, it's a very different conversation. I was at an educational event for GPs the other day, and we spoke to lots and lots of GPs. Obviously, they're a selected group. They're chosen to come to this health ed event, it was called, but they were coming up to our table. There were a few of us there as volunteers, and they were asking about chronic UTI. They all knew what it was. So I think if we've done nothing else, we've started a conversation and we've raised awareness. We now have the Urological Society of Australia and New Zealand this year has released a statement, an official statement, acknowledging the existence of chronic UTI and importantly, acknowledging that the tests routinely used to diagnose UTI are not effective in diagnosing a chronic UTI. So that, I mean, we don't agree with everything in that statement, but it's a huge breakthrough. And, you know, if I was with my daughter now, 7 years later, I would be printing off that statement and taking it to the urologist and saying, well, look, in fact, your own professional organisation says this.
Yeah. I think that is a huge step forward.
Yeah. It is a huge step forward, yeah.
That kind of brings me to the other question, which is what kind of resources can Chronic UTI Australia provide for people living with recurrent or chronic UTI? Because patients do often want to print something and take it to their doctor.
Yes, so if you go to our website, you know, just Google Chronic UTI Australia, we've got a whole section of resources, and we've worked really, really hard on our resources. We're quite proud of them. We're quite proud of the research and evidence gathering that we've done to produce them. And there's a whole different range of things. I don't recommend that anyone goes to a new GP or even their existing GP with a wad of resources, because I've done that before and it doesn't necessarily go out over well. But, you know, we've got a one-page fact sheet for GPs. We've got a checklist of symptoms that people can go through with their GP to say, well, you know, these are the symptoms I'm experiencing. They can use that to monitor their progress over time. So lots of different resources ranging from quite research heavy and technical to very accessible for patients, and things targeted specifically at GPs as well.
And I think that's so important, because something we noticed early on was that patients would print off the articles on our website, which were intended for patients, and then take them to their GPs who wouldn't take it seriously. So it's really important to have these more fact-based sheets that you can take to a GP.
Yeah, we've also got a new page for health professionals. So if we do find that sometimes patients' GPs are really interested in this area, not as often as we'd like, but sometimes we do. And we've been able, we've started a small group of GPs. So we've got a page specifically for them, and a meeting that occurs every 3 months to support them in understanding chronic UTI.
Oh, that's great. Do you think there are many clinicians in Australia who can help with this problem?
No, not nearly enough. No. And that's really the problem for most people. We've raised awareness, we've raised the conversation, but we hear every day people's experiences of going to a GP or a urologist, and it's the same old story. It's, you know, you haven't got an infection, your culture test has come back negative. It's, you know, it's poor treatment. It's treatment that doesn't resolve initial UTI. It's very much, even when people have a chronic UTI diagnosis, they find it difficult to get access to evidence-based treatment. So unfortunately, there are a few medical specialists in Australia, and that information is shared. We're not allowed to say who they are. But we work closely with a Facebook-based support group, and information is shared privately. Unfortunately, those GPs, because they're so few, they become very overloaded.
It happens quite quickly. That raises the question of how many people you think there are in Australia who experience chronic UTI.
I wish I knew the answer to that, and that's something that is very much on our agenda to try and get better information on. At the moment, because we have no official government recognition of UTI, we don't have an official definition, we don't have any data collection, we don't even have data collection on recurrent UTI. We don't even have survey-based data. So the short answer is we don't know. I mean, my best guess, based on, you know, what's been done overseas and a bit of survey evidence on recurrent UTI, that it's in the tens of thousands, you know, where it pains to to say in our communications, this isn't a rare disease. It's common. We think it's becoming increasingly common, but we don't know, and I think that's a huge problem in terms of advocacy, that we can't provide the most basic information. That I know as a government bureaucrat that that's the first question any minister will have. Well, what are we talking about here? Are we talking about 100 people, or are we talking about 1 million people? Yeah.
Exactly. I think it's the same problem with grants, because you need to be able to show why you need this grant and the rationale for it, but none of this data exists. And we're constantly, researchers reach out to us to see if we have any information about how many people might experience this or a specific type of symptom, and the data's just missing. And it makes it very hard to move forward.
You're absolutely right, Melissa. And I think if we're going to get data, we need a proper firm definition that's agreed, and we need specific data collection on that. But I think it's the same in the UK and Europe and the United States. It's missing.
Missing everywhere, and you need funding to be able to do this type of large-scale research.
So it's a bit of a catch-22 situation. We haven't got the information, so we can't get the funding, so we can't get the information.
Exactly. Yeah, we have this problem on a daily basis, and it's difficult. We're trying to fill small gaps as we can to make it easier for the next project, but it takes a lot of time.
It does. Yeah, absolutely.
You brought up testing, which is one of the topics that is probably the biggest in our community. What's the access to testing like in Australia? Is there anything aside from standard UTI culture?
Look, there is, but you really have to be connected and informed to be able to access that treatment. A lot of our patients, the patients in the community that we're connected to through the Facebook support group, follow the technique that wasn't pioneered, but it was used by Professor James, the late Professor James Malone Lee, because a lot of our patients are treated by that clinic in London because of the difficulty of getting diagnosis and treatment in Australia. So that's the protocol for testing is based on a combination of looking carefully at the patient's history and symptoms, as well as looking for particular cell types in fresh, unspun urine. So that's kind of a difficult test in a way, because it does mean that your pee has to be immediately fresh, and that's something not a lot of labs offer. We have a few different naturopaths and other health practitioners who offer that test, but that's not covered by our Medicare, and it's not easy to access, particularly if you're living.
You need to be there in order to.
You need to be there.
Drop a sample,
In 2017, I had to put my daughter on a plane to go and pee in a cup in London, in Harley Street, London, and I had to do that twice, and she had to stay there each time for 2 or 3 weeks. So
such a long trip for something that should be so simple and accessible.
Yeah, she had to stay there so the professor could look at the changes in her cell levels once he introduced antibiotics. So that was obviously very difficult, but at that time necessary. Things have changed a bit because since the pandemic, people have been doing telehealth appointments with that clinic. And as I said, there are a few practitioners who offer that urinalysis, but not very many, and you have to be in the know. The other thing that some patients do, as you would know, is they get those PCR tests or to identify different bacteria. I think the limitation of that is similar to the limitation of cultures, is just because you identify a bacteria, you don't really know that that's the one causing your symptoms. But some patients find that helpful, and in some, I think, not all that common situations, it does identify a particular bacteria that is, it just shouldn't be there, and it's possibly not responsive to what you're doing. So, but again, that's expensive, you know. So I think somebody in the survey that we did said, you know, chronic UTI is a rich person's disease, and unfortunately that's the case. You know,
it is an access problem, and a lot of the resources that are available cost a lot of money, and they're not available in lots of areas in the world. So it's a really complicated problem.
And you have to be, you know, you have to be literate and informed, and you know, be well enough to participate in these things and advocate for yourself. And that's, you know, that's hard. It's not for everyone.
It's a really good point too, because it is really difficult to advocate for yourself and just to keep on pushing to the next thing. Not only is it expensive, but it takes so much energy, and you have to constantly make decisions and just be able to see the next doctor and to think about what you're going to say. It's a full-time job just to try to recover.
It is, and you have to do it when you're not well. I'm fortunate to be well, and I've been able to support my daughter and do all those things for her. But if you don't have that, you're expected to finance all this when you possibly can't work because you've lost your livelihood. You're expected to see endless health professionals when you're so unwell you can barely leave the house. It's a really big ask.
Yeah, and trying to keep it together while professionals tell you that it might be in your imagination, or that the symptoms you're experiencing are not real, which makes it even more difficult.
Yes, at one emergency department, I was called aside while my daughter was being seen in the ED. At that time, she was literally writhing on the floor in agony and going to the bathroom every 10 minutes. And her urine, when I saw it in a cup, which I now know I didn't know then, it was very cloudy. It was full of floaty things, which were probably epithelial cells in response to her bladder shedding. But I was pulled aside by a nurse and just quietly informed that my daughter was a drug seeker. And what I didn't say, which I would have said, is that, you know, if she was seeking drugs, they wouldn't be antibiotics.
Right. It doesn't make any sense.
It doesn't make any sense at all. There are better drugs than that.
It always surprises me how many people have been told similar things, or that it's in their imagination when their urine is full of blood or particles, or it smells. Like, there's so many things
that's the other thing,
physically visible.
My daughter was she had a grey tinge to her skin, and she was sweaty, and her urine smelled, and it looked funny. I mean, these are all signs that it shouldn't require a 12 years of medical training to diagnose.
Shouldn't. No.
It really shouldn't. But because of these tests, which are just not accurate, you know, they're putting dipsticks in and doing cultures and saying no infection there. It's crazy. It's kind of, it's almost comical, but it's really not funny.
I always say the similar things. It would be funny if it wasn't happening to so many people and it causes so much pain. But the thing that makes no sense to me is that if the test says it's negative, there's still something going on. So even if it wasn't a UTI, something should be done about these symptoms. There needs to be an investigation.
Right. And the pain that people are experiencing and the lack of ability to get on with their lives. But instead, people are gaslighted and said,
incredibly so.
Just said, look, I mean, even now, my daughter sometimes are told things like, well, you might have had an infection once, but, you know, and that might have set up a kind of pathway in your brain that means that you're feeling pain, but you're not really in pain because you don't have an infection anymore.
And somehow that pathway is causing the blood in the urine and the particles and the smell too, which is a very powerful mind in that case. But it's difficult to continue, just like we were saying, when you keep on facing these types of conversations. And
I think, I mean, it's easy for me to smile because it hasn't happened to me, but I think for the people it has happened to, there's an element of trauma.
Oh, completely.
And I think it can affect people's experience and they're willing to engage with medical professionals in the future, which can potentially be very dangerous if people do not trust doctors and don't want to go near them. Even once they're cured of it might be something that's not even related to UTI or chronic UTI. It will affect their health in the future. Just having that trauma and that distrust of medical professionals.
And the trauma is very real. I think one of the reasons that a lot of us laugh about this together is because it's a way of coping. Because if you're not laughing about this, you're crying.
No, you're not laughing because it really isn't funny.
Not funny, no.
But what has amazed me that as an advocate, not just individually for my daughter, but when we first started chronic UTI, I thought it was going to be easy because it's just such an obvious problem. There's lots of different studies going back decades that the tests that doctors rely on to diagnose a chronic UTI just don't work. And my background, is in really complex and probably unsolvable problems like, child protection, mental health service provision, really difficult things. And I think I was very naive because when I came across this issue of chronic UTI and I did I read the studies, I thought, wow, finally, I've got an easy problem. I see you laughing.
And if only.
All we have to do is write this down, and I'm a writer, I write submissions and letters all the time, in a coherent way and send it off to these professional organisations and government. They'll say, oh, I'm so sorry, we didn't realise. We'll immediately set up a working committee and we'll develop new medical education, we'll develop guidelines. This is just unacceptable. So the first thing we did once we incorporated as an organisation, there were 6 of us who signed a letter that outlined all this, very compelling research. And I just sat back waiting for, the horror and the action to begin, and it didn't. And 7 years later, we're still in a situation where every day patients are being told that they don't have an infection when they do. Things have changed a little bit. There's a little bit more help, but as we've been saying, unless people know where to go, how to advocate for themselves, it doesn't happen. So, I think in terms of the goals of our organisation, we still have the same goals, but we really think that this isn't just an individual problem, it's a problem of a community of people. We've developed some really great advocates, allies, in the medical community. But where we are now is that we think that grassroots patient advocacy, people coming together to demand change, is that we think that's what we need to get change. It's just despite the progress that I think we've made, I really don't think we're going to get the changes that we want without a coordinated patient voice and a push. And can I just tell you a little bit about what we've got going on at the moment?
Of course, that'd be great.
So we're right in the middle of it, so I can't really speak to the outcomes, but so far the signs are encouraging. We're 3 weeks into a 6-week campaign. We've called it the Take Action campaign. The details are on our website, but what we've done is we've written an open letter to the Health Minister, which we haven't sent yet. We're collecting signatures, and so far we've got more than 1,000 signatures on that.
Amazing. So
that's we're encouraging the patient community to sign that. It only takes 30 seconds, so that's a really easy thing to do. And then for people who want to go a bit further, and we hope that they do. We've got a template for people writing to their members of parliament. And so far, the results are really encouraging. We've had several MPs who've written back in response to those letters saying that they've escalated this issue directly to the health minister. So, that's
great.
Really encouraging.
Is that a template that we can put in the video description so people can find it? Okay, excellent.
Yeah, please do. I mean, we need signatures from Australia, but I think the more patients who get on board with advocacy worldwide, the faster this is going to progress. And that's, so we've also got, we've developed a number of what we call social media assets that people can share on their own social media. And some members of our patient community have got lots of different followers. So it's just another way of getting the word out there. But in terms of getting what we want, which is things that everyone wants, new evidence-based guidelines for UTI, evidence built into medical education. We might not be able to change the mind of your 75-year-old GP, but we can provide the correct information to people, to doctors coming through. In Australia, we desperately need a specialist treatment clinic. It's really, really expensive for us for our patients to be treated through the UK, because obviously there are no Medicare supplements. So we want that. We want more research. I mean, I'm sure you'll agree that we need better diagnostic tests. We need quicker treatments. Being on antibiotics for a long
years at a time sometimes,
isn't anyone's idea of fun, and there are some patients who don't tolerate that very well. So we need that research. We need the funding. And I guess where we've got to, after writing off our letters thinking everyone was just going to do what we wanted them to do, is that we need people to get involved as patient advocates and joining the communities that exist in the UK, the United States, Europe, and Australia and New Zealand, to say we want better. We want better than.
I agree with you. It's really important for the patient voice to be heard in this. You mentioned the need for a treatment centre, but what treatments are currently available in Australia for UTI?
Well, for chronic UTI, people, as I said, a lot of our patients are following what is the only evidence-based treatment for UTI, which is full strength, often a protracted course of antibiotics, and that's. Increasingly, we have GPs who are on board with that, and quite a few of our patients are accessing that. Some of them work with the Artemis Clinic in London. Some of the practitioners prefer to have that kind of support and imprimatur from that clinic, but it's difficult. I think in Australia, and it's probably the same in the UK, GPs are really, because of concerns about AMR, are really reluctant to prescribe antibiotics, and then you start getting people prescribing, low dose regimes, which might work initially, but run the risk of really not working and exacerbating a chronic UTI. People who cycle constantly through short courses of antibiotics, which is a recipe for disaster. So that's difficult. Some people access, there's all kinds of things, ranging from Chinese herbs to the phage therapy, which That's accessible, though not readily accessible in Australia. Some people are getting it from overseas.
Okay.
We do have, sorry.
I was just going to ask about hip recs because I think it's more available in Australia than it is in
It's
most places.
it's very easy to get a hip recs. I could go down to the chemist now and get that. It's available over the counter. That's and that's a really important for people who can tolerate it. It's a really important part of the treatment regime. We can get access to Euroimmune, and that's good because 7 years ago when my daughter had a chronic UTI, I twice got on a plane and went to New Zealand to get actually got on 2 planes because there was only one clinic that I could get it from in the middle, like pretty literally in the middle of nowhere. So I got that and took it in past the Beagles. Probably shouldn't have.
Yeah, of course.
But you know, that's not, we know from anecdotal experience suggests that some people respond really well to that, but it isn't a cure for chronic UTI. In my daughter's case, it did seem to reduce the frequency of her flares. So we're going through the process again right now of trying to get it in Australia. But some people, it seems to help some people and not others.
Yeah, we hear a lot of reports of kind of what you said, that it can reduce the inflammation or the flares, and that's a big thing in itself. Just to have a little bit more respite from the symptoms, it's worth pursuing if you can. But again, it can be quite expensive.
Again, it's expensive and it's not that easy to get. In Australia, we can get it through a special access scheme, but the GP has to fill in a special form and send it away for approval. And just this week, or just yesterday, actually, my daughter we decided that it would be good to add in Euroimmune to her treatment plan. And she went to her GP who said, no, we're not going to do that. You know, it's
because it's difficult to access, or because they don't think it's helpful?
Difficult to access, I think, was the main reason.
Okay.
Yeah.
But that should be the patient's choice if they want to follow through that process.
You'd think, yeah.
You would think. But I know Chronic UTI Australia has done some of its own research in the Patient Voices report. Is there insights about that you can share?
Yeah, look, I actually wrote this down because I actually did the survey because I've got about, before I was a government bureaucrat, I was a survey researcher. So I thought I'd dredge up my 35-year-old experience in running surveys, which I did. And we did something, we surveyed 410 people with symptoms of chronic UTI. I think we started in 2022 and released the report in 23. And I was really very impressed with the quality of the data and the information that people shared with us. So it was a mix of closed-ended questions and open-ended questions, but all the data was really powerful, and but people would write reams and reams about their experiences. It was clear that there was a lot of passion there, and I went through and coded all of that information. So there were four themes that came out of the survey, and the evidence from that for those 400 plus people was really strong. Chronic UTI severely impacts people's quality of life. This isn't a trivial condition. That people's lives, their relationships, their ability to work has in many cases been completely derailed by having a chronic UTI. We had 10% of our sample, and there was certainly nothing in the survey that prompted this, tell me in response to open-ended questions that they had felt suicidal or in fact had planned to take their own lives because of this condition. This is an extremely painful condition. Our ratings of pain were, at its worst on average 8 out of 10, which is nearly 8 out of 10, which is a very high pain threshold. So there's a lot of pain, a lot of dysfunction, and a lot of mental distress associated with this condition. The second finding was that people in general had really, really poor health care experiences, and we've talked about this in gaslighted, dismissed, in some cases even yelled at, told that what they're describing doesn't exist, isn't real, and simply the fact that the tests and treatment that are being offered to people are having unnecessary surgical interventions. They're being put on drugs for interstitial cystitis, which have unpleasant side effects, that the medical profession is not delivering what people need. The third finding was that people who've done a little bit of research, who've found the support organisations, who've found the websites that exist, are really angry. They feel angry and let down that the evidence of the failures, the research evidence that exists about the failures of these tests and treatments has not translated into any kind of clinical practice over such a long period of time. So people feel let down and angry about what's being offered to them. And the fourth problem is that this condition, it results in costs to people, as we've discussed, financial costs, all kinds of lost opportunity costs in terms of their lives, their productivity, but it also results in a lot of lost productivity. I mean, a lot of cost to the health system. These people are seeing multiple different health providers. They're having hospital admissions. They're seeing specialists, GPs, naturopaths. There's a huge amount of, and you'd be aware, Melissa, that we have it publicly. Well, it's subsidised, but it's subsidised from the public purse. So the public purse is paying a lot of money for tests and treatments and specialist visits, ED visits, hospitalisations. That is wasted money.
Yeah, and it really makes sense for the government to address this in order to save money long term, which is why for patients it just makes no sense that this is still a problem and that it feels like nobody's trying to address it.
That's right. I think it just comes back full circle. If the powers that be for the authorities aren't interested in at the moment, then the patients have to mobilise. They have to band together. They have to make enough noise to point out that this is just ridiculous, and it's not a problem that's going away. It's a problem that's probably becoming worse as treatment courses are reduced, as people's infections aren't being cleared by sufficiently by the initial treatments they're being offered. We don't have solid evidence of this, but we do have some data from Australia and elsewhere suggesting that this isn't a reducing problem, it's an increasing problem.
It does feel that way. I think it's also important to maybe provide a little bit of hope, because we do hear from people who recover from chronic UTI.
Of course we do.
Find a way forward. So I wanted to see if you have that too.
Yes, we do have hope. I'll tell you, my daughter did an initial, she did the protocol under the guidance of the Artemis Clinic in London. She was completely symptom-free for 3 or 4 years. Unfortunately, in the third trimester of her pregnancy last year, she had a UTI that rapidly became chronic, whether it was some residual infection or the fact that she, for whatever reason, is prone to chronic UTI. But she's done another almost a year of the treatment protocol, and she's just withdrawn successfully from antibodies. So there is hope. Yeah, there is a lot of hope, both for individuals and I think politically. I know that in England, this has been debated in Parliament. As I've talked about some of the advances that we've seen in the public discussion MPs starting to take notice. I think there is a lot of hope, but it's slow. It's certainly slower than I thought at the start, and we've got to keep pushing them. And no person can do it on their own. It's not something that we. So it's a big ask for people. They're not well. They've got a very distressing condition. But if patients do whatever they can, not only to advocate for themselves, but to advocate on behalf of the community, I think that's a really good thing.
Yeah, and it shows how important the patient organizations are. And that kind of brings us back to the beginning of the interview where we talked about, where I mentioned how people have reached out to see if we have advice on starting a patient organization. And I wondered if you have advice or cautions too, because I feel like when I talk about it, there are many cautions, especially if you're still unwell. It is very difficult to take on something like this if you are not recovered or if you're not advocating on behalf of other people.
Yeah, don't do it by yourself. That's one thing I would say. I don't think. I mean, you need to have at least one other person who will be able to cover when you're not well or things are happening in your life. So, do your research and find out where the gaps are. Find out what's needed in your country or local area. You might be like Australia, depending on where you live in the world, and there is nothing. So we had a lot of scope to form a national organisation with the agenda around better testing and treatment for UTI because there wasn't anything. Dot the I's and cross the T's, which isn't really my forte, but unfortunately there are others in the organisation that do that. Do the proper processes around establishing your organisation formally, thinking about your funding sources, thinking about how you're going to present a professional face or image, probably with definitely with limited funding. So when I did my research on rare disease organisations, I found that chronic UTI isn't a rare disease, but it's got a lot of similarities in being a kind of overlooked disease. And there's a lot of organisations that come and go in that space because people think, I'm going to honour my child's memory, or I'm going to make this disease hasn't been researched enough and I'm going to start an organisation. It really isn't that easy. You've really you've got to be prepared for a lot of work, and you've got to be patient, which also isn't my forte.
You've managed so far. It's been a long time.
These things take a long time. A change takes a long time. Change is difficult. And the other thing is you've got to work with others. You've got to work with other patient organisations. You've got to make friends. You've got to make allies. You've got to be able to communicate. You've got to earn the trust of the patient community.
Yeah, it's all really good advice. And it kind of highlights how much you have to think about this. It is not easy. And if you start something to make an impact, you'll have to be doing it for a long time.
Yeah, and you'll have to put in a lot of work. And look, maybe the work that you've done, that we've done in Australia, that Laura's doing in the United States, maybe that will make it easier for people.
I hope so.
In some ways, there might be that we've reached enough. We've pushed the boulder up the hill far enough that the next little bit will be a lot easier for the people who want to get involved in advocacy from here on. That's what I'd like to think anyway.
Yeah, me too. And I'm always happy to hear from other people looking to start organizations or who have Facebook groups or other types of support groups.
Yeah.
Because I think we should be working together. It would be the way to move things forward.
Yeah. And I think we are moving things forward. It's just not quite as fast as I would have liked it to be.
Yes, we were also hoping it would be done by now, but I think we have many years ahead to really get it to where it needs to be.
Possibly, yeah.
So I like to sometimes end an interview with a question. If there was one thing you wish people knew about UTIs, what would that be?
Oh boy, that's a tough one. I've learned so much about UTIs. Look, I think don't believe the tests would be my number one. If you go to a doctor and you're experiencing symptoms of a UTI, or you have a UTI, but maybe you've had 3 or 4 days of antibiotics and the symptoms are not resolving or they're coming back, and the doctor says, oh, look here, this culture test has come back negative. Do not believe that. We know there is ample evidence that these tests don't work. So be my number one. And I mean, related to that is if you've had 3 or 4 days of antibiotics and your UTI hasn't come back, you need more treatment. You might be someone like me who can get a UTI and clear it really rapidly. You might be lucky that course of antibiotics just hits the nail on the head, but you might not be. And that if I could reflect on the experiences of so many people I've been in contact with and that I've surveyed, it's always the same story. A chronic UTI, which is so devastating, starts with an acute UTI. Get rid of that acute UTI. If you've got recurrent UTI, get on top of that. That's what I'd like to say.
Yeah, I guess part of that message is that UTI should be taken seriously from the beginning.
Exactly. It's not from the beginning. It's not trivial. I think some people think that this is just, oh God, the UTI, everyone gets a UTI. Would you please shut up? For some people, it's trivial and easily resolved, but it can be a lifelong, unfortunately, for the worst affected people. And we've spoken to people in their 80s who've had problems for decades, 50, 60. For some people, it can be a lifelong miserable journey. So it's not trivial. And
agreed.
And it can lead to other problems, kidney problems. Urosepsis it's just not a trivial thing. I think the medical community, research funding, it needs to step up the game in terms of UTI.
Yeah, agreed. And I think, as I mentioned, that we are seeing a slight shift towards that because of the AMR conversation. And I hope that means more funding will become available so that we can get the answers that we need.
Yeah, I think it will happen. I probably sounded a little bit negative in this interview.
It's hard not to. There's a lot of challenges.
But we will get there. And I think it relies on patient advocacy to make sure that we get there sooner rather than later. So as the people who are suffering now are helped as soon as possible. And importantly, that people don't develop these problems just because we have tests that don't work and treatments that aren't effective or contribute to the problem.
I mean, that's a really good point to end on. I wanted to thank you again for sharing insights about Chronic UTI Australia, and we'll put the links to the resources that you mentioned in the video description so people can find them. And I'm sure we'll be talking again very soon.
Thank you, Melissa. It was really nice to speak with you.
Thanks so much for watching. I hope you found this expert video helpful. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTIfree.com for related articles. We'll drop some links in the video description. If you like what we're doing on this channel, you can support our work by hitting subscribe here on YouTube, and don't forget to tick the bell so you'll be notified of our future videos. Thanks again for watching, and until next time, keep asking questions and pushing for better solutions.